I'm Patricia Ercolino, the producer of Sojourners Along the Way, and I hope we have a lot of people out in the viewing audience that are taking advantage of watching Sojourners Along the Way on Time Warner Network and also on YouTube. I want to repeat that because we never know who's watching. I'd love to hear from you, and the way to do that is through email, sojourners3.tv@gmail. Now, if you watch some of the previous programs, you may notice that there is a different email address. This is the current one and the one hopefully we'll stick with. So again, that's sojourners3.tv@gmail.com. And I hope you will take advantage that you can watch Sojourners Along the Way on the internet. All you have to do is go to do a search. Google is so helpful in this. If you go to Google and you put in Sojourners Along the Way and then YouTube. YouTube has been very kind in helping to promote Sojourners. They'll give you the playlist and you can select from any of the other programs. If you do not have a computer, that's no problem. Athens County, and hopefully wherever you live, the public library has computers available for patrons to use. Also, Ohio University. You can get a community card and you can go there, and the people are very helpful, both at the university and the public libraries here in Athens County. And wherever you are watching this, I hope that they're friendly also. They're good people. So watch Sojourners at your convenience. Watch previous programs, again, at your convenience. It's one of the nice things about the internet. It's open 24 hours a day. So enjoy all of the programs that ACTV puts on and Sojourners Along the Way has on available for you. Something that Sojourners has focused on is trying to get information to our viewing audience that will be helpful. We've done a lot of things focusing on health issues, and today's program is going to help you learn about something that is available here in Athens County, First Settlement Physical Therapy. And what is really helpful with First Settlement Physical Therapy is Curtis Sykes is a doctor of physical therapy, so you don't have to get a doctor's referral. You can go there and he can apply to your insurance company, and a lot of things are covered by the insurance. I personally am in a situation because of having a horrendous blood and bone infection when I was overseas, and I lost half of my great toe. Before this time, I never knew how our bodies depend upon our great toes, otherwise called big toes, for balance. Not until I didn't have it. And now I am learning how much trouble has been caused by losing a great toe. I've had the opportunity to go to a couple of different physical therapists, and I will give my stamp of approval to First Settlement Physical Therapy on East State Street here in Athens, Ohio. I am very pleased with how much I have been helped by going there.
Hello, I'm Kurt Sykes. I'm a physical therapist here at First Settlement Physical Therapy in Athens. We've been open here in Athens since 2014, so about a year and a half. Welcome to this session. This is Simon Hargis.
Hi, I'm Simon Hargis. I'm also a physical therapist, and my family, my mother specifically, started the company about 15 years ago, and she's also a physical therapist, so it's a family business. The name comes from Marietta, Ohio was the first settlement in that part of the country, so it's really like saying Marietta Physical Therapy. We've just branched off this way. Kurt and I went to school together, and we're privileged enough to have him running our Athens clinic.
First Settlement Physical Therapy is located at 932 East State Street, across from Walmart, and besides Aldi and the Armed Forces Recruiting Center. You can reach us by calling our phone number 740-592-3778 or visit us at our website at www.fspt.org.
We'd like to talk to you a little bit about what physical therapists do and the type of patients they can see today. So to get off, I thought we'd start with maybe just a quick talk about what this clinic is. This is an outpatient clinic, meaning the patients that come here are well enough to come here and then leave. You might find physical therapists visiting people's homes, home physical therapy, for patients that aren't well enough to leave their home. You might find physical therapists in hospitals while people stay at the hospital, inpatient physical therapy, for people who are just staying overnight there for longer periods. You might also find physical therapists at nursing homes, and where they're either a permanent or a temporary visitor at a nursing home, and the physical therapists are helping there. So you'll find us in a lot of places, and what that means is we really do a lot of things. We go to school for a very long time. Most of us are graduating with doctorates now, and the breadth, which is a big topic of what we're going to talk about, of what physical therapists can help treat, is really, really cool. So from everything from Bell's palsy, pediatrics, sometimes babies are born with something called torticollis, where their neck's like this. So from infants to problems that occur with aging, decreases in balance, increases in falls, just that arthritic pain you're waking up with in the morning, and that overall decrease in your functional mobility. That's something we can help with. So, the scope goes from all different ages to things like dealing with strokes versus things like dealing with, you've just had a rotator cuff surgery or a knee surgery. So we're really, physical therapists are really jacks of all trades. If it has something to do with a problem you're having that involves motion, muscles and bones, we're really muscle and bones specialists. It's something we might be able to help with. Another good example, I think, is really to zoom in on the fall risk and balance. I think that's a big area people don't realize. As they're able to walk less or they're having problems with balance, that's a really common area that people don't realize can be trained. Just like your strength can be trained, your balance can be trained. So that's also something we focus on. And we have, what we're going to also do is kind of like a tour of what is a lot of typical physical therapy equipment, but then some atypical stuff that we do and how it addresses some of these different problems. So even the stuff you see behind us, this is typical strengthening equipment. We have a pair of stairs to my left to help with kind of functional mobility, and that's to say, you both have your straightforward gym stuff, but also these things that are a little more practical. And that's kind of how we think of physical therapy, to get you stronger and moving better, but so it can apply to something very specific and practical in your life. Whether it's being able to transfer better, be more independent, or lift your kids, return to work from an injury, all that kind of stuff we deal with. Do you want to add anything to that? Covered it. Okay. So quick history of the business. My mom started it way back in Marietta, our first clinic 15 years ago. My dad was an engineer. He retired to run kind of the business, so it's a family business, and a lot of the people that work with us are just friends we picked up along the way. I'm a physical therapist. My mom is. My wife is. She works with her mother-in-law every day in Vienna. Kurt went to college with me, and he was a good friend, and several of our other therapists are that way. And here, and I think in general, what you'll find with physical therapists, what makes it also a lot different, is we're still a medical profession that will see a patient for an hour 2 or 3 times a week. And that's pretty rare in, I think, today's healthcare system. It's that problem solving and us getting to know the patients and building a rapport with them, trying to figure out this complex problem they have or simple problem, or what their goals are versus what our goals are, and how those two things can meet. So it's a really rewarding profession in that way. We get to spend a lot more time with patients than a lot of other people get to, which is really fun. I think if you ask, why'd you become a physical therapist? Because we like people, and we get to spend a lot of time with people, especially one patient, which is pretty neat, pretty rewarding. Yeah. So we might start like a little tour of the clinic and talk about some of the equipment and some of the different types of patients we see.
Yeah.
One other quick thing they did want me to mention is physical therapy in general, and how do you go about getting it. Insurances cover it. Private insurances, you usually don't need a script like you would get for a medication at the drugstore. Other insurances like Medicaid or Medicare, you usually need a script. So you would talk to your family doctor or whoever's supervising a particular injury, and they'd write you a script, say, hey, this guy needs physical therapy, and then you'd show up for physical therapy. So it's pretty straightforward. But if you do have any questions on what we can do or how to get started, just stop by, ask. We love fielding them. We love talking about problems. If it's something like, I don't think I'm too busy to come to physical therapy, but do you have a suggestion for me to do something at home? Sure, great. We're really here to be part of the community and help the community health. So if it's anywhere from I got this group of people and I'd love you to show them exercises on, safe sitting exercises for seniors, or stretching techniques for athletes, or I have this random pain that crops up every once in a while on mile 15 of my bike ride. Come by and ask. I mean, we're nerds about this stuff. We're not going to mind talking about it. So I mean, in that respect, I think you'll find that with all physical therapists. They love answering this kind of questions. I mean, really. So maybe let's take a tour and talk about some of the different equipment and some of the different stuff we do to treat different problems.
So next we're going to go over a few of the equipment that we have here at First Settlement. Here are some stairs we use. We might use these with some of our patients that have had knee replacements or hip replacements or trouble with their balance, training them to go up and down stairs, using a proper gait pattern to get back to going up and down normally instead of having to take one step at a time, like a lot of people do after they may have a surgery. Sometimes we'll use them for a stretch, as Simon is doing here. But it's one of the things we do to try to tie function into our treatments and getting people back to their normal function and everyday activities. And then over here we have some of our weight machines that we use to build strength. Typically you'll find these in a lot of physical therapy clinics. How's that feel, Simon?
A little heavy for me.
Wrong weight. This next machine. This next machine is a hamstring curl machine to build strength in the hamstring muscles in the back of the thighs. Again, some of the patients we would use this with would be some of our knee patients, our hip patients, patients that are maybe injured, have a sports injury because of weak hamstrings. And then next we'll come over here and show you the traction table. This machine does both cervical for the neck and lumbar, low back traction. We would hook the patient up to a harness that would help to stretch either their low back or their neck, and it can be very helpful for low back pain, herniated disc, or neck pain, herniated disc in the neck, or just generalized neck pain, stiffness in the neck. And then also for these tables, we don't always use them just for traction. They can be used for a treatment table where we may be stretching the patient's shoulder or doing joint mobilizations on their shoulders or backs or hips. So I'm going to show you just a few quick things on Simon here. If someone has a lot of stiffness in their shoulder after surgery, we may just do some gentle stretching of the shoulder to get their range of motion back. You can stretch that in all different directions. Just like this. Depending how far out they are from their surgery, you would stretch them more aggressively or less aggressively. So Simon has pretty good range of motion here.
Table tennis.
And then another thing we could do are some joint mobilizations for the spine. So if he had a lot of stiffness in his mid-back, I may do some joint mobilizations like this. We're getting a little bit of stiffness there. Simon might benefit from this. There you go. You can sit back up there. And next we'll move right along here. Another thing we do here at First Settlement is work with injured workers. So a worker who has an injury, say a low back injury, they may come for a program called work reconditioning, where they work on building up their strength to get back to doing the job they have to do. So if they have to do lifting at their job, we may have them practice lifting a box to simulate some of the work they do. And we may have to work on their body mechanics to make sure they're lifting correctly. This is another thing we may do with an injured worker. On the cable column here is walking out against the resistance of weights at different angles and different positions to work on building leg strength, simulating walking, pushing or pulling something and having to work against that resistance. Also with this machine, we can do a lot of upper body exercises, shoulder, strengthening for rotator cuff injuries. So Simon will show you a few things we may do with a TheraBand here. Exercises like this. Working the rotator cuff muscles by doing internal, external rotation, things like that. We can pull up a chair here. Another thing we do with some of our shoulder patients, if they have a lot of stiffness after a surgery, is maybe do the pulleys here to work on regaining the range of motion. Good. Next, this is the Xbox that we use to do virtual rehab. There's a variety of different games that we use to play do activities on the Xbox. Some are working on balance and stepping strategies for patients who are at a fall risk. So having them reach for a certain thing on the TV, reaching in different directions and having to step and maintain their balance as they do that. Other games work on upper body strength and coordination, regaining muscle control. Some are for the back.
So,
this game, Fruit Ninja, helps to work on upper body strength and coordination, hand-eye coordination, and regaining some of that fine motor control in the upper body. So we use this with some of our shoulder patients later on in their rehab, once they have gained most of their range of motion back and are working on endurance of the shoulder strength. And then some of the other games we play, some of them may be for knees or hips or low back, working on strengthening or balance. Some of them require you to reach for something and step as you reach, working on balance strategies to maintain your balance if you were to start to fall, things like that. We also have activity for low back that helps to strengthen the back muscles and work on proper mechanics. Nice job, Jackie. This is another activity that we use with our injured workers, working on pushing and pulling weight. We may use this as part of regular therapy or work reconditioning programs.
So we're going to look at some more traditional physical therapy equipment that's both for strengthening and cardiovascular endurance. So Kurt's on a machine that both doubles as a stair stepper, which he's doing now, but then if he changes his stride, can be kind of like an elliptical. For strengthening of the legs, but also fairly low impact, so you're not getting that kind of impact of hitting the ground that you might get on a treadmill. And then you can control the resistance and the stride length also on this machine. So, but next, we might just go down the line here, is your kind of traditional treadmill. We might work on it for, people building up to being able to walk longer, to athletes that are running. Some things you might not realize you can work on a treadmill for. There are very specific low back injuries that are disc problems that going at a really slow pace backwards helps with. I've also used it, actually somebody sitting in a chair behind the treadmill, and we'll pull it for hamstring strength. So we'll kind of use a traditional treadmill in some pretty interesting ways on top of what you might normally see, which is an endurance training or training to get back to running or walking. But again, this is fairly typical equipment you might have in any physical therapy place for any, or even a gym, but then with a physical therapist, you can tailor it to a specific injury and use a device in a way that might not be common. So Kurt's on an arm bike. Again, this is a pretty typical physical therapy machine that would both work on, with a very low resistance, just range of motion of the shoulder, but you can increase the resistance to work on, endurance and strengthening of the shoulder for longer bouts while you're on it. And you can both work on it backwards and forwards, getting two different sets of muscles. And then next, so Kurt's on what we call a recumbent bike, which you can use in a similar fashion with the other machines we demonstrated for strength or endurance, but you can also, Kurt's showing a pretty good knee range of motion right now, but let's say in his left knee he didn't have that kind of range of motion, you could use it going half circles back and forth to stretch out the knee. So like after a total knee replacement, one of our goals would be eventually enough range of motion to do full circles, but you might not start off that way. So again, it's an example of just using these common machines for different purposes, tailoring it to the injury.
With physical therapy, we can work with people of all ability levels, whether they be athletes and also people that may be in a wheelchair. So with someone in a wheelchair, we'll try to meet them where they're at and meet their goals. A lot of the exercises that we can do in physical therapy can be modified to be done in a sitting position, both for the upper body and for the lower body, strengthening the leg muscles, the ankle muscles, knee muscles, and the upper body, the shoulders, the elbows, hands. And once they get strong enough, if they're able to stand from the wheelchair, they can progress to standing in the parallel bars. That's a safe environment with the therapist at their side to reduce the risk of falls, provide a place where they can become stronger and hopefully get to a point where they don't have to use a wheelchair all the time if they are able.
So Kurt is demonstrating our hand table. Hands are really, really complicated, and they do a lot of different things during the day. That means for good hand therapy, we have to use a lot of different types of tools to mimic the kind of functions we want to get back to. My mom actually started off as a physical therapist, then went back to school to get her CHT, which is Certified Hand Therapist, and then all of the therapists we hire have to train with her before they can come and work in clinics. So a lot of First Settlements therapists in particular have a lot of specialized hand training.
So here's another example of what we'd call fairly functional activity to work on grasping, to work on range of motion. But it just takes a lot of variety of different, what looks like fairly normal objects to mimic all the different things a hand can do, because they can do so many different things. And if you think about how much they move in a day, it takes a lot of exercise to get them back to the level that we'd want. So, you know, anything from, we'd see an industrial accident, you know, crush injuries, cuts, to you can replace some joints in the hands, especially with rheumatoid arthritis. They might replace some joints or do some surgeries for something called de Quervain syndrome, where your certain tendons have injuries and inflammation. Trigger fingers, where your fingers won't open anymore, will require therapy after surgery. Carpal tunnel, if both pre-operatively, sometimes we can, with the right bracing and strengthening, prevent a surgery, and after surgery, if it's just not, the strength isn't returning, sometimes we'll work with that, or even very serious hand injuries where they might lose a nerve that makes a certain group of muscles work, and then a surgeon will attach a different group of muscles or a different nerve to those muscles, and the therapy becomes very complicated with splints, but we're able to kind of guide the patient through their progress and through the recovery so they can get back to either, you know, work or normal use of the hand. So it just takes a lot of different variety of tools to do that. This, for example, he's specifically working with wrist range of motion. So sometimes, especially with any joint, it really takes a hands-on approach with where you're manually mobilizing that joint or manually stretching that joint. And that just doesn't go for wrists, that goes for backs or shoulders or hands. And that's something, you know, physical therapists, it's another really rewarding part of the job, getting this kind of hands-on approach with patients. Both for the patient, I think for the therapist, it leads to a lot better results the more hands-on it can be.
This is a hand dynamometer. It measures hand grip strength. So with injuries of a hand, wrist, or elbow, we'll compare the strength of the right hand compared to the left to measure deficits in strength. So to do that, you hold the elbow in at your side, squeeze the dynamometer, and it gives you a digital readout of how much grip strength you have. And then you can do that compared to the other side. Take an average of 3 measurements usually, and that will give you a pretty good idea of the comparison of your grip strength. This is a paraffin bath. We use it a lot for hand and wrist stiffness and pain. Sometimes we'll use it before treatment to help the hand or wrist loosen up, decrease pain, or sometimes after a treatment for the same thing, to decrease pain after the treatment. So I'll show you what it looks like here. I'll dip my hand in it. It covers the hand in a thin layer of paraffin. Dip it multiple times to build up the layer a little thicker. And after 4 or 5 dips, it's usually pretty good. You can put the hand in a cover like this to maintain the heat. And then after about 10 or 15 minutes, you can slide it out and the paraffin peels off. After the paraffin has dried, it easily slides off the hand, and then you can just discard the paraffin. Cut.
So here's an example of a shoulder exercise, and a lot of what physical therapists do is come up with an exercise that helps the patient where they're at in the recovery. As they recover, you switch them to, so Kurt just went from 2 hands down to 1 hand. You slowly tailor those exercises to make it more difficult, to challenge them where they're at in the recovery, so you can keep them healing faster and getting stronger. So this might be one of the final levels for a thrower or for a painter or somebody who's going to do a little more dynamic movement with the shoulder. And so he's now throwing it overhead where he originally was using 2 hands to throw. So we've progressed them through this exercise to make it harder. Now, we're going to show another example using the same device but for a totally different function, which is balance. So this trampoline can be thought of as a compliant surface. So think about when you're walking in a moist yard or on a golf course, and it's harder for you to keep your balance. We might do activities on a compliant surface so we can help people get used to those compliant surfaces if one of their goals to do things in the yard, or even on level ground, the strategies it takes for your muscles to keep you balanced. This challenges those. It helps you keep your balance. And to train that balance, when you practice losing your balance, it then helps you prevent a fall.
Athletics.
We can even do athletic exercises involving jumping with less impact and strengthening legs to return sports players back to more dynamic activity. So the same piece of equipment might double for a lot of different functions. One of the things physical therapists do is figure out how to tailor this to a particular injury. So you might see some of this equipment in a gym or be able to get it, but knowing how to tailor it to the person is really what the profession's about. So we're going to show some examples of what we might do for what's a buzzword that's going around a lot of strengthening lately, which is like core or the postural muscles. So your abdominals and your back. And I like to emphasize to people that they are postural muscles. So what Kurt's doing is trying to maintain a correct posture while he's moving. And that makes those core muscles or those postural muscles tighten up. And that's really their function, to hold you in a position while your extremities are doing something, so they can protect your back, protect your spine, and keep your spine in a alignment that's optimal to working, rather than something that's too flexed or too extended. And there's a lot of different motions and exercises we can do on like a physio ball. That's a fairly common piece of equipment, but the variety is pretty awesome, the variety of exercises you can do in terms of strengthening for both the shoulder, back, and core muscles.
Okay.
So this is an example of a core and back muscle exercise where the physical therapist is cueing the type of control the patient wants, the type of posture the patient wants while the patient does the exercises. And that guidance is really what makes it more effective than doing it on your own. And this is an example, again, with the same piece of equipment, how you can advance to a really difficult exercise, something that a higher level patient that is returning to the level they want, or an athlete or somebody where the pain's really decreased. So knowing how to use equipment in a lot of different ways really shows you the variety. By removing the hands and decreasing the points of contact, he's made it even more difficult, maybe even too difficult for Kurt, which is impressive because Kurt's also a triathlon athlete. So now he's put it back with the hands, and that's the kind of trial and error in physical therapy you try to find that right balance of difficulty but not past what you can do. So in the background, we're demonstrating another kind of virtual rehab game where she's using both kind of visual feedback to balance on one leg and use a dynamic movement to maintain stability. In the foreground, I'm having somebody demonstrate what we call active assisted motion, meaning we're using another arm. Let's say her left arm is hurt. We're using the right arm to move the left arm up because maybe it doesn't have the strength right now to do it. As the patient progresses, we can utilize some of the classes we take. We have to take a lot of anatomy as physical therapists, but we also have to take physics because how the body moves has a lot to do with physics. So right now, as she moves that weight for her shoulder, it's mostly her elbow doing the work and the shoulder stabilizing. But if she moves that shoulder with an outstretched arm, with the weight at the end of the arm, all of a sudden leverage is a really big factor. That same weight close to the body versus that weight with an outstretched arm is a lot different. So we also have other weights on the stack, and each of them progress, but some of them might strap to the body. Some of them might be weights you hold. It just depends on which kind of resistance we think both mimics the function we want to return the patient to. So let's go ahead and move to a strapped weight. So you might have a weight that actually straps to a wrist that allows us to not have to use the hand with it, if we can get it strapped. So sometimes we might practice reaching activities or overhead activies to get patients back to work or daily activities that involve that. A good example is a painter.
Next, Jackie is demonstrating how she would use a gait belt to practice walking with a patient who's having difficulty with their balance, someone who might be at risk for falls, and working on getting back to walking independently. But she's using the gait belt to keep them safe so that if they were to have a loss of balance while they're practicing walking, she could easily help them regain their balance and prevent them from falling. But it gives the patient the confidence to be able to walk without a walker or an assistive device, but still remain safe in the clinic as we're working on getting back to normal walking and normal mobility. This is another piece of equipment that we use here at First Settlement. This is an ultrasound and electrical stimulation machine. First, electrical stimulation, we can use that to help with pain control. So we can hook up electrodes to an area of the body that's painful, and it can help to reduce pain and help muscles to relax. Sometimes we'll use that at the end of a treatment to allow someone to decrease their soreness and leave here feeling a little bit better. Another thing this machine does is ultrasound. Ultrasound can be used to create a deep heating within a muscle, deeper than you can get with a hot pack. So we use that if we're trying to warm up the tissues deep under the skin, or we can use it to help with accelerate healing in cases of bursitis or tendonitis or things like that.
One thing I think we wanted to go over is maybe the progression of education with physical therapy and how it's also related to access. So Ohio is a state that has something called direct access, which means there's a lot of insurances that allow patients to just come directly to the physical therapist without needing to get a script from a doctor. That's coincided with an increase in our education requirements, because if we're going to be seeing patients directly without them being screened by somebody else, we also need to make sure we can screen them ourselves. So all physical therapy schools, including Athens, has its own physical therapy school at Ohio University, an excellent school that both Kurt and I attended and graduated from. That's where we met. They've all started being on the doctorate level, which means most physical therapists graduating today, really, if not all, I don't think there's any non-doctorate schools left, are all graduating with the doctorate. That kind of puts us in the position to be able to also take these direct access patients. So for like private insurances, most of them don't require you to have a script anymore. Something like Medicare or Medicaid would require you to just check with the doctor, talk to them about it, and see if you're a candidate for physical therapy so they can write you a script. But that kind of completes our tour of the facility today. We really appreciate you guys learning about what physical therapy can do and what First Settlement here in Athens has to offer. And we'd love to be part of your lives, and we really love being part of this community. So anything we can do to help, please let us know.
This is a balance exercise, good for ankle stability and strengthening, also good for knee and hip patients, so that they're able to go back to walking on uneven surfaces. Walking on the balance beam creates a narrow base of support, which challenges the balance more than walking with a wider base of support. soft surface of the balance beam conforms either in or out and forces you to use your ankle muscles on the inside and outside of your ankles, again to simulate walking on uneven surfaces, or if you were to start to twist your ankle, to learn to respond, to change the position of your foot in order to not lose your balance or to not fall. This next exercise is called the rocker board. It's another balance activity. Again, working the muscles of the feet and ankles. You can do taps on here in a nice, smooth, controlled pattern to try to bring back coordination and control of the foot and ankle muscles. You can start with your hands on the bars to give you some support. As it gets easier and you get better coordination of the muscles, you can try going to no hands, which makes it more challenging. And then after that, to make it even more challenging, you could go to only one foot and try it with one foot. So if you have one leg that's affected from an injury, eventually getting to that point will work it the most. You can also do this exercise trying to keep the board flat and balance on there, which takes another set of muscles and a different ability to balance. And then after that, tap side to side, working the muscles more on the sides of the ankles and the sides of the knees and hips.
Just start with 5 and see how that feels first.
And just balancing that way also. Try not to let either edge tap down. If the square board becomes easy, or not challenging anymore, it could progress to the round board, which only has one circle on the bottom. And that makes it even more challenging. So you can do similar activities, tapping forward and back, but the ankle has to work a lot harder to stabilize in all planes of motion instead of just forward and back. And you can also do side to side this way. And just balancing, which is very difficult. This next exercise is hurdles, working on flexing the hips and knees during walking to force you to have to bend your knee more than you're comfortable doing. Also works on balance a little bit because you're having to raise that leg higher than you normally would. And also do it sideways, sidestepping, working the muscles on the side of the hips, working on lateral stability. A lot of knee pain can be caused by weakness of the hip muscles, so this is one way to strengthen some of those muscles. Once doing the hurdles in the parallel bars has become easy, we can bring them outside the parallel bars and do higher hurdles that force you to flex the hip and knee even more, just like this. And it doesn't have the support of the parallel bars, so it makes it more challenging once the patient is safe outside the parallel bars. And again, you can do this side to side, working the lateral muscles of the hips and knees. And for some of our higher level athletes, when they're returning to sports, we can use the hurdles for jumping activities in order to get them ready to explode off the ground and absorb their body weight as they're returning from a jump. So I'll demonstrate real quick.
going to talk about aquatic therapy using the HydroTrack underwater treadmill. A lot of insurances will cover aquatic therapy, including this unit. The unit has a dial here that shows the speed that you're going on the treadmill, how long you've been going, and your total distance on the treadmill. Aquatic therapy is a really great tool for patients with low back pain that may not be able to tolerate doing other types of therapy on land, or maybe they can do it but they're having a lot of pain with it and it hasn't been successful. So aquatic therapy can be a great option for those patients that haven't responded well to traditional therapy, or patients who are in chronic pain because their body doesn't respond well to the stress and strain of having the effects of gravity when they're doing exercises. And this creates an environment with less weight bearing on the joints of the low back and the hips and the knees. And along with that, patients with arthritis in the hips and knees or even ankles will benefit from aquatic therapy because it puts less pressure and weight bearing on the joints. Even athletes can benefit from aquatic therapy. Athletes that are coming back from weight bearing restriction, either due to a stress fracture or injury where they were not allowed to put weight on a joint for a while. The water temperature is in the low 90s typically, so the water feels very warm to the patients and helps to loosen up muscles and even reduce pain because of the warmth. Okay. Once the water levels have equalized, you can walk into the main tank, and then we will close the door and pump the water from the front chamber into the main chamber, and pump that water back in, and that will fill the water up to about chest high. Next, let's start the treadmill and have you walk on the treadmill. And we can increase the speed a little bit, which will make it a little bit faster. And it goes all the way up to 7 miles an hour. So for our running athletes who are returning to sports, we can have them start in the water if they have a weight-bearing restriction or have had an injury that has prevented them from running, and this is a good way to get back to running without the impact of running on ground. Another thing we can do is use the jets in the front to give more resistance. So if we turn those jets on, you can see the turn to high. A little bit hard to see the bubbles coming out there, but the jets are on now, which gives more resistance. Next, we will have her enter into the HydroTrack chamber, where she'll perform the rest of her exercises. Next, we'll do backwards walking on the treadmill. So we'll reverse the treadmill belt on the HydroTrack and have her walk backwards. Try upping the speed just a little bit more. There we go. Walking backwards, which works muscles in a slightly different way than walking forward. Next, we'll do sideways walking on the treadmill. So we'll go ahead and turn the treadmill on. She can step sideways. And this will work the muscles on the outside of the hips. And with walking sideways, we can also turn the jets on again to get more resistance going that way also. And you can see some of the bubbles coming out of the jets there. Another therapeutic exercise we can do in the HydroTrack is bicycling in place. So the upper body is supported with a pool noodle, and the patient is able to just move their legs like they're riding a bike, working on hip and knee range of motion, some strengthening of the leg muscles, and it also takes some pressure off the low back as they're doing that. It usually feels pretty good. Alright. And as they're supporting their upper body above the water line, they have to use their arm muscles to get an upper body workout as well. We can also do some upper body exercises using some TheraBands here, working the shoulder muscles and scapular muscles. The next exercise we'll do is marching in place, working on hip flexion and knee flexion. You could also use the jets to give more resistance with this exercise. Next we'll do hamstring curls in the water. This is working the hamstring muscles in the back of the thighs. Also working on bending the knees and the range of motion in the knees. So this is a good exercise for patients who have arthritis in their knees or arthritis in their hips or weakness in their legs to help build their strength back up. The resistance of the water provides a nice strengthening exercise. This is another exercise that if we wanted, we could turn on the jets to provide a little extra resistance. Another therapeutic exercise that we can do in the HydroTrack are heel and toe raises, working on ankle range of motion and strengthening the muscles in the front and back of the shins. Another good one for patients who have knee pain or ankle pain.
This piece of equipment is called the body blade. It's great for strengthening shoulders and rotator cuff. So there's several different motions that can be used with it. One was holding it down at your side, and you just try to move the ends of the body blade back and forth. It's pretty tiring, but a great strengthening exercise. You do it in all different motions to strengthen different muscles. Out like this. Come out to the side, and even working across the body, which is a higher level, more advanced way to do it.
I was given permission to relay one person's experience at First Settlement Physical Therapy, and I was asked not to give the person's name, but I could tell the story. They had been in a really bad car accident and were unable to walk for a number of years. But after coming to First Settlement Physical Therapy, they not only regained use of their legs and strength, but they are now walking unassisted. So I want to pass that on to you, that it works. Try it.